Jason Rissman is lucky to be alive. After contracting COVID in December 2020, he spent 70 days in a coma.
I texted my wife. I said, I've got to go to sleep for a while. I love you. I'll talk to you when I wake up.
Rissman is a special agent with Homeland Security. He got COVID at work before the vaccine was available.
As a result, I have some residuals that I'm still seeking treatment for.
There's no clear number on how many people in San Diego are living with long COVID. Experts say it's hard to track. Many patients aren't diagnosed or don't realize what's wrong.
There's people who have cognitive issues where they're forgetting things. They have what they call brain fog. There's people who have endurance issues. There's people who have mainly respiratory issues. There's people who have cardiac issues.
Christopher Malloy manages the La Mesa Rehab in East County. He says they've treated more than 120 long COVID patients since the pandemic began. They combine pulmonary therapy and physical rehab.
People come in tears saying, I just want to go back to work, but I'm not the same anymore. I don't have the endurance, I don't have the strength.
Dr. Tammy Peavy is the rehab's clinical director. She says there's no official test to diagnose the condition or a standardized treatment plan for long COVID, which can impact nearly every system in the body. She says too often, patients are referred to physical therapy without being properly evaluated for breathing issues.
So I think it's really important to send the message out to doctors that if a patient comes in with shortness of breath, do not be afraid to send them to pulmonary rehab.
La Mesa Rehab is one of only 5 clinics in San Diego County.
I think the saddest thing is there's only 300 clinics like this in the entire United States. We should be more prepared than that, and we should certainly be taking better care of the patients who haven't recovered from the COVID.
Deborah Franklin still deals with blurry vision, body pain, loss of taste and smell, and a relentless cough.
And I have had long COVID since December 2021.
Rehab helped her realize she wasn't alone.
Because I got to see other people with it. I'm absolutely not crazy because the doctors kept saying, well, no one else has this.
Another challenge, health coverage.
There's been issues with people being denied workers' comp.
California Senate Bill 1159 used to make it easier for people to get workers' comp if they caught COVID on the job. But that protection expired in 2024. Now, workers have to prove they got COVID at work. Peavy says that makes it tougher for long COVID patients to get coverage.
We have to go back and ask for more visits. These are long-term patients.
Dr. Alan Lee is a psychiatrist.
And there's another medication that my doctor wants to prescribe me. It's $3,000 a month.
He says even with his medical background, it's hard to get care after being infected with COVID in 2022.
One of the struggles is, of course, just working with insurance to try to get things authorized, because these treatments can be expensive, and especially for a novel illness where a lot of the treatments are not yet approved.
After a heart rate monitor claim was denied by his insurance for not being filed properly, Alan says the company sent him to collections.
As you can imagine, being really tired and everything like that, it's really hard to take care of these kind of things.
Federal support for long COVID research is also dwindling. The Trump administration is planning to close the Office for Long COVID Research and Practice. 5 years since the pandemic hit, research, recovery, and treatment for long COVID patients remains uncertain.
But it's just been a long journey.
Franklin might retire early.
Now I have to wear a pamper to work because my cough is so aggressive. I really have to figure out if it's worth it.
Rissman continues to fight for proper care.
I was too stubborn to die, and I'm too stubborn not to get treated properly.
Dr. Lee can't work anymore and now finds himself struggling to keep up with his kids. A few minutes on the playground can knock him out for up to 14 hours in bed.
Regardless of how tired I am, I mean, these moments, they are, you only have so long with your children. So it's always worth it.
With no clear roadmap, health experts say long COVID patients are left to navigate a system that is still learning how to manage this complex condition. Heidi de Marco, KPBS News.
Oh, here we go.